The really unfortunate thing about chronic hepatitis C is that there aren't many symptoms. In fact, there are often no symptoms. And so, whereas you might have had some flu-like symptoms or something kind of off for a little while when you have acute hepatitis C, most of the times those symptoms go away. And now you're back to normal. Maybe you have a little fatigue, but probably you don't feel anything, and you're carrying chronic hepatitis C. Hepatitis C is a disease that's transmitted through blood. So if you come into contact with someone's blood who has hepatitis C, you're at risk of getting hepatitis C. Even people who are born to mothers with hepatitis C can get hepatitis C. This is why all pregnant moms-to-be should get screened for hepatitis C. People who are substance users who inject drugs can also get hepatitis C because the needles they use may not be completely sterile. If people share needles, they can potentially get hepatitis C. People who had blood transfusions prior to 1992 may have picked up hepatitis C from those blood transfusions. The reason is we didn't really know what hepatitis C was until the late 80s, early 90s, and blood banks around the country weren't testing and screening the blood for hepatitis C. So, if you're someone who received a blood transfusion before 1992, or if you received an organ donation before 1992, you were at risk for getting hepatitis C back then. Sometimes people who work in healthcare can get hepatitis C. So if they have needle sticks, it's less likely. Fortunately, it's not passed through saliva, so kissing, not a problem if you have a partner that has hepatitis C. It's not passed airborne. We all know about airborne illnesses. Things like kissing and hugging and shaking hands, generally no problem. One good thing to realize is that hepatitis C isn't generally passed sexually. Anybody who has blood-to-blood contact, which is most common during anal receptive sex, is at high risk for hepatitis C. If you've never been tested for hepatitis C and you fit that category, you should definitely talk to your doctor about getting tested for hepatitis C. I just don't think there's a stigma. I really think the bigger problem that I've been reading about forever is that a lot of physicians just don't test patients for hepatitis C, don't talk to their patients about hepatitis C. Now, though, we test for hepatitis C quite frequently because the guidelines suggest that everyone should be screened. So basically, if you're between 18 and 79 years old, you should get a hepatitis C test at least once. If you have risk factors for hepatitis C, you can be screened or tested as much as you need. You just need to talk to your doctor.